Welcome to Physician Heal Thyself, the podcast, empowering you to take a whole person approach to your well-being, spirit, soul, and body. Join me, your host, Dr. Lara, naturopathic doctor, entrepreneur, and a servant of Jesus Christ. We are not just a body, we are spirit and soul. It's time to integrate medicine and spirituality into our healing. Let's get started. Welcome to Physician Heal Thyself, the podcast. I'm your host, Dr. Lara. Today, I want to talk to you about something that is super important that I find a lot of people struggle with this one thing, and that is neuroinflammation. So what is neuroinflammation, right? So neuro is referring to the nervous system. We're referring to the brain. And so it's inflammation in the brain. So if you've experienced any brain fog, fatigue, depression, anxiety, cognitive decline, right? You're having difficulty remembering things or where you left things. This could be a sign of neuroinflammation. Now, of course, there's many other conditions that we have to rule out first, but let's talk about what is neuroinflammation. So in this episode, we're going to break down 4 essential questions that we're going to address. What is neuroinflammation? What causes it? And how can we detect it? And then most importantly, what are some ways that we can treat it naturally? I want to start off by saying that this episode is for educational purposes. I'm not trying to diagnose you or treat you. You have to speak with your doctor about this, right? So let's get started. What is neuroinflammation? So neuroinflammation, like I said, it's inflammation specifically within the brain and the central nervous system. So what is the central nervous system? The central nervous system is going to consist of the brain stem, and the spinal cord, right? Anything that exits from the spinal cord out into the limbs, your arms, your legs, that sort of thing, that is the peripheral nervous system. So the peripheral is anything that has to do with, the extremities. So central nervous system is the brain and spinal cord. So normally the brain is highly specialized, right, to have an immune defense system as well. It has its own immune system, defense system. And so primarily, the immune cells of the brain are called microglia. And so these cells consistently are monitoring the brain for injury, for toxins, infection, and damage. The microglia are part of the immune system, kind of like part of the lymphatic system. So when microglia detect a threat, they're going to activate the inflammatory response. And so in short term, this response is a protective response, and it's going to help to clear up any debris, fight any pathogens that it senses in the central nervous system, and also to repair the tissue. However, when the inflammatory response system becomes chronic, meaning long-term ongoing exposures of debris or pathogens or any damage there, the microglia are going to remain activated, and they're going to begin producing inflammatory chemicals such as cytokines, reactive oxygen species, and nitric oxide. And so over time, the chronic activation can disrupt neural signaling. It's going to cause impairment of the neurotransmitter balances, and it can damage neurons and, of course, alter brain function. So in other words, neuroinflammation can fundamentally change how the brain is operating. All right. So I always say that inflammation, there's always going to be some degree of inflammation in our body. Inflammation is what signals the immune system to respond. Okay. So in moderate levels, low levels, here and there, it's normal. If you go work out at the gym, you're going to create an inflammatory process because after breaking down the muscle, that's what you're doing. You're causing an injury to the muscle by creating muscle breakdown, for it to break down. The immune system is going to go there to repair that. And yes, that is still involving the nervous system. When we work out our muscles, we are also working out our nervous system. We're also working out our immune system. So that inflammatory process is important. It's supposed to be there to be able to send the healing factors to the muscle to repair it, to rebuild it, make it stronger. So when you go to the gym next time, guess what? You can build heavier, and your recovery time is faster. That's also a sign. We're going to talk about symptoms that are associated with neuroinflammation, and I'm going to go through several of them. But let me just say, since we're talking about working out, is that if you work out at the gym, even if you don't work out really hard, and it's taking you a long time to recover, more than 3 days to recover that muscle group that you worked out, and it's consistently always this way, there's something neurological there, and immune system as well, that your body should be able to repair that muscle. Now, it might be your diet. Maybe you're not eating enough proteins and not enough healthy fats, right? And good complex carbs. Maybe you're not resting enough. If you're not sleeping to allow your muscles to recover, that can be a problem. Maybe you're not drinking enough water. That could also be dehydration, is not going to allow those muscles to be able to heal and repair. But then there could be other neuroinflammation issues. So let's talk about, patients rarely are going to come and say to me, I think I have neuroinflammation, right? No one goes to their doctor and says, I think I have neuroinflammation. But they are going to present with the following symptoms. The very first one, I get a lot of people who say, I have brain fog. And what does brain fog mean? It's like you can't think with clarity. You can't concentrate. Like there's not clarity in your mind, right? Memory problems with short-term, long-term memory issues. I see more frequent having short-term memory issues like we call it working memory. Working memory is if I give you my email address, you're able to write it down as I'm saying it to you. Some people can't even do that. They'll have you repeat things over and over because they're not able to recall the letters and the numbers or words fast enough. So that's working memory. Difficulty concentrating. So you feel like you're in the clouds. You feel like your head's in the clouds. That could be a symptom of neuroinflammation. Chronic fatigue. Sometimes people will say, I don't feel tired in my body. It's like I feel tired in my head, or both. But chronic fatigue is a sign. Depression and anxiety are other symptoms as well, because obviously neurotransmitters can be affected by inflammation. Certain parts of the brain can be impacted more if there's inflammation there. And so that can cause symptoms of anxiety or depression. However, I always suggest ruling out other medical issues like low vitamin D or low vitamins in general. We also want to address any thyroid issues, any hormone imbalances, because those things can present as depression and anxiety as a symptom. Depression and anxiety are symptoms of something much deeper. So we have to dig deeper to find the root cause of it, right? And neuroinflammation might be part of that. Sleep disturbances can be a symptom. So can't fall asleep, you can't stay asleep, you keep waking up at night. Headaches. If you have headaches anywhere in your head, that could be a sign of neuroinflammation. Sensitivity to light and sound, so just feeling irritable. And more severe or prolonged cases, neuroinflammation could be linked to some of these medical conditions. Alzheimer's disease, Parkinson's disease, multiple sclerosis, obviously traumatic brain injuries can be linked to neuroinflammation. Long COVID, we saw that COVID created a lot of neuroinflammation in some people. And then chronic fatigue syndrome, which is really a broad term for something else that's caused this chronic fatigue syndrome. So in functional medicine, natural medicine, increasingly we recognize neuroinflammation as a root cause mechanism underlying many chronic neurological symptoms. So we need to find out what is the root cause. So what causes neuroinflammation? It's rarely is it going to occur in isolation. It's usually going to be driven by systemic processes that affect the entire body. So let's take a look at some of the most common contributors. Gut inflammation and that gut-brain axis. So I always tell patients the gut, the digestive system, and your brain work hand in hand. So whatever's going on in the gut can impact the brain, and whatever's going on in the brain can also impact the digestive system. And this is because we have that famous vagus nerve that leaves the brain, and it is going to make its way through the neck, innervating to the heart and into our gut. And there's a lot of nerve innervation. So that is the one cranial nerve that leaves the head and is innervating into the physical body. And so it does reach all the way into the gut. So this gut and brain are deeply, deeply connected. So if there's intestinal barrier compromises in the digestive system, like leaky gut, any inflammation that's in the digestive system, it is going to affect one way it's going to affect it's whatever you eat. You might not be able to break that down efficiently, and you might not be able to absorb the nutrients that the rest of your body needs. So if your body's not receiving the nutrients, if it's not able to activate, there are certain vitamins like B12 and iron and vitamin D that are activated in the gut and in the digestive system. And so if they're not being able to be converted to active forms, then you're not absorbing them, and your body's going to be deficient of that. And yes, low iron is going to affect your brain health. Low B vitamins is going to affect your brain health, and low vitamin D absolutely will affect your brain health as well. So if there's gut issues, any gut dysbiosis, even if you have parasites, look, I keep hearing so much on social media, everybody has parasites. No, I don't think everybody has parasites. We all have natural gut bugs, right? Our gut bacteria that are there, but not everyone has parasites. And there's also many types of parasites. I do believe that there's a good percentage of people out there that might have a parasite and they have digestive issues. And of course, that will severely cause brain neuroinflammation. And you're going to have a lot of those symptoms, the brain fog, right? Depression, anxiety, because it is the parasite that's eating what you're eating. It's taking up all those nutrients, and your body is creating inflammation to try to get rid of this thing, but it can't. So there's some good pharmaceutical medications, natural medications, and sometimes I'll combine both. I do test for the parasite, what is it, before I decide to, detox the patient, because some parasites need different medications or herbs. And so we want to be very strategic to kill it off. And then once that parasite is killed off, we need to make sure that the body is flushing out anything else, any remnant of it, that nothing is left behind, and then rebuild the gut. So gut dysbiosis can be a major driver of neuroinflammation. The other thing that can contribute are chronic infections. I see this all the time. So anything in a persistent infection that can cause, chronically will stimulate the immune system. So infections could be viral infections like Epstein-Barr virus, very common to see neuroinflammation. People will have headaches and feel depressed or anxious and feel very tired, a lot of brain fog. Epstein-Barr, a lot of primary care doctors don't want to check it, but they have to check the full panel of Epstein-Barr virus, and that could be present there. Of course, we talked about COVID, long haulers, that's something that affected many people. Lyme disease and other tick-borne infections, tons of neuroinflammation. And they're tricky to sometimes treat, because Lyme disease will be dormant, and then it'll, come out. And so you have to be consistent with treating these conditions. Mold-related illnesses, if you have mold, you've been exposed to not just 1 or 2 days, like chronically you've been exposed to mold, it can cause some of these symptoms of neuroinflammation. And of course, any sinus infections that are chronic, ongoing, can cause it. And then dental infections. This is something that a lot of people seem to overlook. When I have people that we've done a lot, I look at their mouth obviously and say, okay, do you have mercury fillings? Do you have root canals? Is it infected? And getting the dentist involved into that conversation to clean up anything that needs to be cleaned up. Look, there's biological dentists out there. And these biological dentists, they have a different approach to cleaning things out and the different types of procedures, treatments that they can do. And there's tons of them here in Arizona. So these infections may they may continuously be activating the immune signaling pathways that can affect the brain, and then therefore causing neuroinflammation. The other thing that can be a cause of neuroinflammation is blood sugar dysregulation. So high glucose, high blood sugars, insulin resistance is going to increase oxidative stress, therefore causing inflammatory cytokines to be present in the nervous system. And so this is why some researchers are now referring to Alzheimer's really as type 3 diabetes. And I learned this even in medical school back in 2014 and 15, where they talked about Alzheimer's is like type 3 diabetes. If we manage the blood sugars and the insulin response and give the body what it needs, then the brain will, function better. Now, sugar, to me, it's like throwing fuel in the fire. And so the fire, in this sense, it's inflammation. And if you already have inflammation there and you're eating a lot of sugar or high carbs, simple carbs, right, in your diet, you're just adding more fuel to this inflammation in your brain and your body. So the brain needs glucose to function. Yes, that's true. However, it can exceed a certain amount. Once it exceeds that amount, it will start to create brain fog and a lot of other mental health symptoms. Environmental toxins is something else that can cause neuroinflammation. So exposure to these neurotoxins, right, can trigger inflammation in the brain, whether it's mold, heavy metals like mercury or lead, air pollution, pesticides, and any other industrial chemicals that sometimes people work with these chemicals. And even with wearing an industrial respirator, they may still get exposures to these chemicals causing some of this brain inflammation. So we want to be very aware of that. Obviously, chronic stress. Chronic stress, long-term elevated levels of cortisol will disrupt the hypothalamic pituitary adrenal axis. Long phrase there, right? But it's the brain communicating to the adrenal glands to release cortisol. And in that, it'll disrupt not just the adrenal glands and the brain, but the thyroid and any other hormone. So over time, this can impair immune regulation, right, and promote neuroinflammation. Now, I want to also add in here with chronic stress, I want to talk about trauma. Now, trauma can be broken down in many different categories. A physical trauma causes stress. So if you were in a car accident and you maybe think, I didn't hit myself, I'm fine. But if you had any kind of whiplash response, which if you're in an accident, you will, if that impact was strong enough, you can be experiencing a lighter form of a concussion. Concussions don't always show up on imaging. Most of the time they don't. And those kinds of concussions caused by whiplash can take time, weeks, for them to really present the bigger symptoms. So it could be 6 to 8 weeks. I've spoken to some neurologists. They say some concussions, they don't even start to assess till 6 to 8 weeks post-accident, because that's when the symptoms will start to really show up. So you might have walked away from that accident, not a scratch, just feeling fine. But if you're having headaches, if you're having the brain fog or just the brain fatigue, if you are feeling depressed and anxious, all of a sudden your working memory isn't there, please note that you may have a concussion. There might be some injury there, and it's causing neuroinflammation. So the MRI, I'm just telling you right now, most of the time, the MRI, CT scan, whatever imaging you do, it may not show the actual inflammation. It may not show signs of an injury to the brain. That's good. We don't want it to show up. But it doesn't mean that there's not inflammation in the brain, especially when you have these symptoms. And the longer you go without treating it, that becomes chronic, and that becomes more difficult to resolve, right? To remediate that. So please note that if you hit your head, you fell off a tree. I've had people tell me, I fell off a tree, I fell off the roof of my head, off the roof of my house. They hit their head, a concussion. Even if someone hits you with a pillow, right? I mean, you think a pillow soft, but if they hit you hard enough, you can't have neuroinflammation because of that. So anything that's hitting the head can create some neuroinflammation there. So that's physical trauma. Now let's talk about psychological and emotional trauma. If you were in an abusive relationship for 20 years, I guarantee you have neuroinflammation. I see this all the time in both men and women, because yes, men also are in abusive, whether it's emotional or psychologically abusive relationships. When they leave that relationship, it's like they're brain dead. They can't think straight. Yes, there's anxiety, depression. They think it's from the loss, and it is, but it's like your nervous system now is away from the constant threat that now you are trying to figure out, your brain's trying to figure out things, right? And so that constant cortisol release in your body, cortisol in the brain, it will cause inflammation long term. Cortisol in the brain inhibits our prefrontal cortex from being able to think rationally, right? To use our critical thinking skills. And this is why making decisions when you have neuroinflammation, it seems like so impossible, right? It's so difficult. And literally, it's a headache. And so if you've walked away from any abusive relationship, even a work situation, any relationship, any environment that you left away, that it was a trauma, that you experienced hardship and trauma and loss, your brain is going to have neuroinflammation. People who are grieving loss are going to have some neuroinflammation. So what we're going to talk about, what are some things that we can do right at the end of this episode to help the brain to bring restoration. And so just keep in mind, this chronic stress isn't just, it could be physical stress, it could be chemical stress, it could be emotional, psychological stress response. And I have so many cases, just so many cases, and even in my personal life, where I have seen this stress be the main cause of neuroinflammation. So when we address the root cause, then the brain is feeling safe. And I'm going to talk about some very unconventional ways to also help address it. And you know what? It's not going to cost you a penny. So the other thing that can also cause neuroinflammation, and this is huge, is poor sleep. If sleep is when the brain is detoxifying, right? It's restoring, and it's detoxifying that lymphatic system, the glial lymphatic system. It's restoring that. And so sleep cleans the brain and nourishes the brain. New cerebral spinal fluid is being developed there. And so sleep deprivation reduces the brain's ability to clear all of that metabolic waste. And so therefore it's going to increase, inflammatory signaling to the brain. So it's important to sleep. If we don't sleep, it'll cause neuroinflammation. And that's also the medicine for neuroinflammation. It's not for you to sleep all day, but for you to get quality sleep at night, if that's when you sleep. Some people work, graveyard shifts, so they won't sleep at night. But whenever they do sleep, they have to be able to fall asleep and stay asleep for a good amount of time. 8 hours for women, men 6 to 8 hours. The studies show that I've talked about this before in other episodes. Studies show that if men sleep 8 hours, no less than 8 hours, they're good hormonally. And women, they need 8 to 9 hours before it starts to impact their hormones. So, but you know what your magic number is. Some people tell me 6 hours, 7 hours is good. I can't sleep any more than that. Then that's where you're at. So how is neuroinflammation diagnosed? Diagnosing neuroinflammation, it's going to be challenging, like I said, because if there's no signal that's being detected, it doesn't mean that it's not really present. It's just not showing up on imaging. It's not showing up on labs. And that's a good thing if it's not showing up, because then when it is showing up, that means it's very severe. It's causing major destruction, right? So, clinicians, we combine when we assess neuroinflammation, we're combining, we're looking at symptoms, we're looking at history, whether it's any accidents, any traumas to the head, any mental, emotional, psychological trauma, any laboratory markers, so we will do blood work, obviously, and imaging if necessary. So these are some of the tools that we look for inflammation. So some of the blood marker tests, and these are conventional. I'm going to talk about some that are not so conventional. It's the C-reactive protein, also known as CRP. The erythrocyte sedimentation rate, abbreviated as ESR, and then cytokine panels. Most of the time it's your CRP and ESR that doctors are checking to test for systemic inflammation. And this could be inflammation anywhere, not necessarily specifically to the brain. And so while these do measure, like I said, the systemic inflammation, they're not associated to the brain. So there's other tests that we can check. If there is a gut, if the digestive system is involved, sometimes people are not hungry or they can't keep food down. So we'll do gut microbiome testing, right, to check for parasites and bacteria and the probiotics and inflammatory markers that are specifically to the gut, digestive enzymes, and it's a whole panel of looking at what's going on with the gut. Sometimes food sensitivity tests can help. I'm not a big fan of them because I know that that's usually not the root cause. Usually it's the gut or the brain. It could be infectious disease. It could be the immune system response. But in some people, food sensitivities can at least let us know which are the foods that are triggering their immune system, right, to have a response. And I'll tell you right off the bat, gluten is a neurotoxin. So if you eliminate gluten, and we'll talk about this ahead, but eliminating gluten and sugar are going to significantly start to reduce neuroinflammation for you. There's organic acid tests, which some doctors do, some don't. Mycotoxin panels that are going to look at the mold, if there's anything there. Heavy metal testing are some tests that we could do, because if there's mercury and lead involved, we need to know so that we can use the proper tools to eliminate them from the body, to properly detoxify. There's a process to do it safely. You don't want to pull too much metal all at the same time. We also need to make sure that the person has healthy kidneys and a healthy liver to detoxify, and that they're having bowel movements when we're removing heavy metals. So these tests will help to identify some of the root drivers of neuroinflammation. Now there's, the imaging. You could do the PET scan that's going to target looking at the microglia that's going to detect neuroinflammation. There's other cognitive and neurological assessments that I do. There's one through Vibrant Wellness that I really love to use, and it is looking at it's a neural panel. It looks at all the inflammatory markers, but it's also looking at infectious disease. So it's going to look for antibodies for the major infections that are known to cause neuroinflammation, like the Epstein-Barr, COVID, cytomegalovirus, some of the herpes viruses could be in there. Strep is one to cause neuroinflammation. So it looks at the infectious disease, and then it looks at antibodies that are, again, antibodies as they relate to neurotransmitters. So is there anything that the immune system is attacking certain antibodies? And there's a lot of inflammatory markers on that panel, and I find that seems to be more accurate than looking at the other test. We obviously can do neurotransmitter testing as well, but these the neural panel that's looking for inflammation, that there's a test on there that's specific to the glia cells. So sometimes the immune system starts to attack those glia cells, and in essence what it's doing, it's killing off the system that's meant to clean up the debris in your body. So those are just some ways to assess. And then obviously there's just some cognitive assessments. It's just asking questions and the observation of the physician, observing the patient. We can see what the symptoms are, and simple things that I'll ask, like since you've had this injury, have you noticed that responding to an email or receiving an email, receiving a call, text message, does any of that stir like any stress or anxiety where it didn't before? And they're like, actually, yeah. They'll start to see certain behavioral patterns, like a lot of procrastination, a lot of avoidance in their behaviors, and that's a sign of brain inflammation. So let's talk about some natural strategies on how to reduce this neural inflammation, right? So I want to really, we're always going to keep it back to the basics. Every episode that I've ever done from the beginning to now, I keep talking about the same things over and over. And there's 4 very important things. We call it the pillars of health, right? Those 4 pillars of health are never going to change. So they apply to neuroinflammation. One of them is going to be the diet. 2 is going to be exercise. So you want to keep exercising because it makes the brain, the mind-body connection right. And so the nervous system is working and it's flushing inflammatory markers out. Sleep, we talked about sleep. That's the 3rd pillar. And then stress management is going to be the 4th. So we're going to talk about the anti-inflammatory diet. It's going to be, a whole diet, whole foods diet, not consuming processed foods. The thing with processed foods when there's neuroinflammation is that processed foods have so many ingredients, so many chemicals in there that it's hard to then identify what is it in this product that's making me sick. You can't even tell. So the best way to do is get rid of it. Don't buy canned foods. Get whole foods and fruits, that are right off the field if you can. Obviously, we have to go to the grocery store to buy these things, but get it from the fresh produce section. Omega-3 rich foods, so whether it's fish, olive oil, avocado, or sometimes I do have people supplement with omega-3 to ensure that there's a consistency of a certain dose that you're getting. I'll tell you that the safe range for omega-3 or for fish oil to take daily is anywhere from 3,000 to 6,000 milligrams a day. Obviously, you're going to divide those doses. And that might not be right for everyone, but that's the range for it to be therapeutic. You need to be at that range. If you're taking 1,000 milligrams and it's a cheap fish oil and you think this is going to help for the inflammation, it's not even touching it. Some cases that I've had where there's rheumatoid arthritis, a lot of inflammation, neuroinflammation. If there's no contraindications in their health, I will dose up to 3,000 milligrams a day. So they're doing 2,000 milligrams 3 times a day. And we do it for a period of time. We don't do it forever and ever. We do it for a period of time. We start to see inflammation come down. There's other things like curcumin that will dose also at a higher range for a period of time, not to be long-term use. And then once we start to see a shift and change in their inflammation, in their symptoms, then we cut back by half and stay there until we reassess again. But whole rich foods, omega-3 rich foods, the brain loves it. I want you to think of omega-3 as this. Omega-3 is going to be like a cleaning the cells and cleaning the surface of your brain. That's what it likes to do. It likes to be, it reduces the oxidative stress. So you want omega-3, not omega-6. You want more omega-3 rich foods in your diet. You want to eat those colorful vegetables because they have the polyphenol nutrients in there. Those polyphenols protect your cells, reduce the oxidative stress. You want to eat vegetables with color. All right. Healthy fats such as olive oil and avocado, drizzle it on your salad. And you do want to cut back on the refined sugar and ultra processed foods. This is, like I said, fuel to that inflammation. So it's just going to make things worse. So cut the sugar out, cut the gluten out. Dairy for some people can be an issue too, but at least those 3 things you definitely want to reduce them, if not cut them all out together, and just stick to get your protein, get something that's protein based, and get your vegetable, and that's what will help with some of the neuroinflammation. So it's more of a Mediterranean style diet. anti-inflammatory diet minus the bread and the pasta, right? Unless you are in Italy or Spain or somewhere out there, their food is better than ours here in the United States. You won't have a response to inflammation. A lot of it has to do because of it's real food. They don't have a lot of fillers like our food does. So the other thing we want to support is that gut, the digestive system. So in order to help restore the gut health and reduce neuroinflammation, you want to make sure you're having the fiber-rich foods. So get your broccoli, get your greens in there, right? Fermented foods can help. A good probiotic, prebiotic as well, can help you identify those food sensitivities. Like I said, gluten and sugar, dairy, get them out. You don't even have to go spend $200-300 on food sensitivity tests. Just cut these things out and find out, like, is this making you feel better once you cut it out? So yeah, let's treat the gut dysbiosis and support the digestive system. The third step that you can do is optimizing your sleep. So that 7 to 9 hours of true restorative sleep is going to allow the brain's glymphatic system to remove that inflammatory waste. And so sleep hygiene is going to be very important. Be consistent with your sleep schedule. Limit that blue light exposure before bed, so put your phone away. And then just make sure the room is nice, the temperature you prefer, and that it's a dark environment for you to sleep in. We talked about already about some specific nutrients that target the brain, that help reduce inflammation. Those omega-3 rich foods that we talked about. And if you have to supplement, that's fine, because at least you know the dosage and you can be consistent with that. Curcumin, I mentioned that you really want a good quality curcumin. If you get something cheap, it's not going to work. Yeah, you can eat it in your diet. You're going to have to eat a lot of it. But what I have found is that when we supplement with a quality curcumin that the body's going to be able to absorb, it will people will significantly see a reduction in their symptoms, and we know that inflammation is coming down. Resveratrol is a good nutrient to add. Of course, magnesium. There's good forms of magnesium. Vitamin D, you got to check your vitamin D levels. So many people, even if you live in a nice sunny state, are still running around with low vitamin D levels, and that can definitely affect the way your brain functions. And then, of course, get a good B complex, one that's already activated, that's a methylated vitamins in there, so that your body receives the full benefit of those B vitamins, right? So those are some good nutrients to help target. There's a lot of herbs. I can have a whole episode. I might just have to do a whole episode on herbs that are good for neuroinflammation, but also for brain function in general, the neurological function. But there's a lot of herbs, bacopa, rosemary. You could add rosemary to your food. But yeah, there's many other ones. Centella is another great herb. So exercise is going to be also part of the regimen for helping that reduce the inflammation, right? Especially the nervous system. So when we are working out, I mentioned this earlier, when we are working out, it is the most intelligent part of us. It is our nervous system. It is the brain that communicates through the spine, that communicates to those peripheral nerves and tells the muscle what to do. Then the muscle does the action and it pulls the bone. And that's the hierarchy of order in our body of intelligence. It's not the muscle that's more intelligent. It is the nervous system that's more intelligent. So when you are doing a bicep exercising and you're really focusing on having the right posture and do the contraction, you're engaging the nervous system there consciously. And so it's not just about swinging those weights like crazy, like I see at the gym all the time. It's about making that connection, because when you work out intentionally that way, you're working out your central nervous system as well, the peripheral as well. So, but you're helping the brain. So by doing so, that exercise is going to promote that brain-derived neurotropic factor. That's all abbreviated as BDNF. It's going to improve insulin sensitivity, because our muscles have receptors insulin receptors. And when we work out, those receptors are activated to work more efficiently. It's going to reduce systemic inflammation overall. And then again, the neuroplasticity of our brain. It's going to enhance the neuroplasticity of our brain by just exercising. It could be walking. And I say, if you walk, be intentional about your walk. Your foot, how your feet are stepping in front of you, every muscle that's engaged in that process. Maybe tighten your core when you're walking, like if you're doing a sit-up, but just tighten your body as you're walking and be intentional. Even when you're hiking, and watch. When you're done after your walk, you'll notice like my abs are sore. Yes, because you were intentionally engaging all those muscles, your glutes, your quads, your hamstrings, all of that, right? Stress regulation is also going to be very, very important. So we know about breath work and meditation and spending time in nature and practices. This is the part that I want to integrate, that one thing I said that's not conventional. It's free. Anybody can do it. You can do it from anywhere. And that's praying. You can be very intentional about praying into your nervous system and asking God, let your peace come upon me. Let it nourish my brain. Let it nourish the frontal bone, my frontal cortex, my parietal parts of my brain, my occipital, the amygdala, everything. Like, just let your peace come and nourish and be living waters that are nourishing my brain. And it comes down. So that's like a prayer and a visualization, a meditation combo of inviting God to come into your Holy Spirit, to come into your body, to nourish this and to bring peace in the areas of your life that there's chaos, that there's fear, right? Wherever there's uneasiness in your body, in your nervous system, for Holy Spirit to come into you and bring peace and balance there. You would be surprised. I do this with patients. They're laying, I pray for them and I guide them through that, and they feel better, not just in the moment, but then after they leave, they say they feel a difference, right? So you can do this for yourself too, of bringing that peace into your body to bring ease. And sometimes we do need others to guide us through something like that, especially if there's a lot of trauma. But prayer can be something that helps regulate your nervous system as well. And it's not just a prayer itself, it's praying to God, to invite him into your life, into your presence, to bring the healing. And it's not just transactional, but it's because you really want God in your life. Those are the ones I see receive healing, is that they surrender, submit. I did an episode on that. Surrender and submit, and let God come in to bring healing into your life. And really to be in relationship with God. It's not just transactional, it should be relational. And that's when I see healing happen in a supernatural, miraculous way. So as I get ready to close up here, just know that there are physicians, there's healthcare professionals that are, trained to focus, to diagnose and treat diseases and so forth. But neuroinflammation is going to require that we go deeper in. And I often find that patients, we do all the testing, they're doing all the things, but if we're not addressing the root cause, which for some people it is trauma, it's been the many, many years of you holding back on expressing what needed to be expressed, of doing what needed to be done, then you're going to find yourself in a state of disease and that of stress response that causes inflammation. So we need to find, where's the stress response coming from that's causing the inflammation. It seems to be attacking the brain, but for some people it's just much deeper, and it might be emotional, it might be trauma, right? So just remember, we have to address all things first to start peeling those layers of the onion. Is it digestive, right? So is it the diet, toxins, sleep, stress, lifestyle? And then, we can oftentimes restore balance to some degree in the brain there. But if there's still something lingering, then we have to look at your past life experiences, traumas, emotional traumas, physical traumas as well, to ensure that we bring some healing there. So, hey, I want to thank you for listening to today's episode of Physician Heal Thyself, the podcast. If you found this information helpful, my ask is that you share it with someone that can benefit from this. If you have questions, ask away. If you want to learn more about this topic, definitely let me know. But until next time, I wish you the best and be blessed. Thank you for listening to Physician Heal Thyself, the podcast. If you like what you've heard, please like, share, and subscribe. Help this message reach more people who may need to hear it. Leave your comments. I want to know what you think. If you're interested in learning more about Raices, visit our website at raicesndmedcenter.com. Until next time, be blessed.